Without wasting much time, because we have just 30 minutes, and explaining entrepreneurship in 30 minutes is like explaining what is love in 30 minutes. There are some topics which we can't catch them in words, or we can't describe them, and entrepreneurship is a topic of that stature. So let me start without any delay. So uh, before going to the topic, let me clear few things. This topic is not something which I am going to advise to you. Neither it is my own story, but because we all are at a stage where we don't need any advice. And एक खूप सुंदर शेर आहे, मुझे ए दोस्त मुझे नसीहत ना दे खुदा के लिए, ए दोस्त मुझे नसीहत ना दे खुदा के लिए, मेरा वजूद ही काफी है मेरी सजा के लिए. वी ऑल आर इन टू सो मेनी थिंग्स. आपण आपल्या आयुष्यात ऑलरेडी इतक्या गोष्टी करत असतो, भोगत असतो किंवा अनुभव घेत असतो. म्हणून मित्रत्व टिकवायचं असेल तर कधी मित्राला सल्ला देण्याच्या भानगडीत पडू नये असं म्हटलं जातं. सो टू maintain a level of a friendly talk, I won't advise anything, but I want to make some points definitely. My talk starts with this is my father, Dr. Arvind Annadate. Please don't get confused. I am not launching any new party. Neither I am trying to gain sympathy like Uddhav Balasaheb Thackeray or Supriya Sule, trying to show photograph of her or his 75-year-old pediatrician dad आणि मग ते लेक नारळाचं पाणी आणि तसलं काही नाहीये. I just want to tell you how the thought of entrepreneurship started in my own mind since my childhood. My father is a successful pediatrician, completed his DCH in 60s 70s, and he ruled his area, a part of Marathwada called Vaizapur. Even today he is practicing. I am talking here in IMA Hall of Nashik, but he is seeing patients. So I was born with a silver spoon, I should say, born to a rich pediatrician. And but in my entire childhood we never had our father for our family dinner. I never remember that we went for any vacations. So our father we could see only when I joined him. The time that I could spend him only was when I passed my MD pediatrics and started working with him as a second pediatrician in Vaizapur. So that was the only and typical life of a single owner hospital, starting at morning 5 till late 12 o'clock. And you can see, meaning you can definitely see the satisfaction on his face. But this meaning my quest of entrepreneurship started looking at his life. He has given us a very good living, a good education, and whatever we wanted in our life. But uh, first, let us talk why of entrepreneurship for doctors. Friends, we all know that we are the best brains in society, no doubt. We have passed the toughest exam. Most of us were first in the class, first in the town, first in the place, first in Marathwada. Even I was first in Maharashtra state in 1997. So we all were toppers. And there are only two tough exams, meaning at least when I passed MBBS of Mumbai University, and even today to some extent NEET and UPSC. PG NEET and UPSC are two toughest exams where very high number of students they compete and very few can get through. Even after that, we prove our academics, we prove ourselves in brain, we prove ourselves in society. After that, even in our practice daily, we face complex challenges. But looking at this, I always think that is our brain, our intellect, our dynamism meant only to be used to treat patients? And I always believe that being a clinicians or whatever profession, whatever branch we have taken up is just a profession that we have taken up, but it is not enough for the brain, for the intellect, for the dynamism, for the adjustment skills that we gain throughout our practice. Definitely this practice is a very limited challenge for whatever skills God has given us. Again, I see around in the industry that in even you must have seen that very ordinary people who have not been toppers or who have not been bright academicians or till their 40s or even 50s, they have not done anything extraordinary in life, a small business, but at one point they learn the basic entrepreneurial skills, basic management skills, and they build huge organizations. There are many people around. I can give you 1000 examples. Recently I met Hanumantrao Gaikwad of BVG Group, the person who rules the ambulance services of this nation and the housekeeping of these nations, who caters housekeeping to Rashtrapati Bhavan and all the who's residences and government residences. This simple person, he disburses a salary of 300 crore in 1 month, and 80,000 people work with him. So I think these are, when I talk to them, when I interact to them, or when I dwell deeper into them, I realize that they are definitely not extraordinary than our class of people, that is doctors. So when I'm telling that we can go to entrepreneurship or we can be entrepreneurs, does it mean that we have to leave our practice? Does it mean that we leave our place, go to Mumbai, go to Manchester, go to Chennai, or do something? Definitely not. Just let us, because doctors or our medicals, we are used to definitions, textbooks. So just go through Google definitions of entrepreneurship. What is entrepreneurship? It is creation or extraction of economic value. These are very typical definitions that you get in textbooks, but this is not entrepreneurship. Definitely, I want to come to the point. Entrepreneurship is viewed as a change generally entailing risk beyond what is normally encountered in starting a business, which may include other values than simply economic ones. These are again same definitions by many authors. So again, coming back to the question, that does this mean that we have to leave our practice? If you see all the words in all these definitions by n number of authors, see the words risks, economy, values beyond economy, productivity, investments, product, new techniques, innovations. So if you see, all these words are central to our practice. We are taking risk, we are into productivity, we are offering something more than economic value. Our profession, there is more than economic exchange between the patient and doctor. So looking at all the definitions or what is entrepreneurship, we all are already entrepreneurs in a different way, but there is some fine tuning that is required to make into perfect entrepreneurs. So the answer to the question, that if you are thinking that I am trying to tell you to leave your practice and become Tatas and Birlas and Adanis and so, or whatever, Sanjay Ghodawat or Hanumantrao Gaikwad, no, it is not that. So what is the difference between entrepreneurship and practice? There are four kinds of things that a person is into when he is working. First is simple employment. The best example for this is doctors working in corporate hospitals. So you work on terms and conditions of some organization. There is a SOP given, there is a standard operating protocol which is given. You have some rules, regulations, you have a payment, or you may have perks on that, or you may have some incentives on that, but the rules for that work are not set by you. This is one simple thing. Second thing is where 99.9% of doctors fall into, that is self-employed. That means we have employed ourselves into our business or into the practice model, and this is a typical Raja, what I call as a Raja and Praja model, that there is one king who is the practitioner and all followers in his clinic or hospital, and they build a coherence, economic coherence, and there is exchange of services and money, and he is a self-employed, he is employed to himself. What I'm talking to is, what I'm talking about is the third thing, that is entrepreneurship. It is where you may or may not work for your organization. That is an optional thing for you. It's an option for you. It's a luxury, or it's, if you are passionate, you can continue doing that, but it doesn't affect your organization. It is an idea where people work for, not for your business. Again, see, entrepreneurship is not sales and services. It is not purchasing ventilators and selling to the doctors, or it is not sales. It is where people work for your idea or your, the model that you have created. And the last thing is investment, where, which I think just now we heard, that our money, we employ our money to earn money from that. I think there is going to be a lot of discussion on that, whatever mutual funds and investments and all that things. More than that, this slide is very important for us. Slide is very important. See, this is Maslow's pyramid for needs. Most of us, you who are into psychiatry or psychology, it is the basic of psychology. So whenever a doctor starts practicing, he is here बेसिक फिजिओलॉजिकल नीड्स. कुठलाही डॉक्टर जेव्हा प्रॅक्टिस सुरू करतो, पहिले 8-10 वर्ष आधी थोडेसे पैसे जमवूया, गाडी घेऊया, मुलांसाठी चांगले कपडे घेऊ, आधी घर बांधू, घर घेऊ. ऑब्वियसली आय एम टॉकिंग फॉर मोस्ट ऑफ द फर्स्ट जनरेशन doctors. Once these needs are fulfilled, then he goes for safety and security. Then insurance, LIC, health insurance, म्युच्युअल फंड्स, SIPs झालं. त्याच्यातूनही पैसे सुरू झाले, त्याच्यातूनही पैसे यायला लागले. ते बघायलाही वेळ नाही. मुंबईला, पुण्याला एक फ्लॅट घेतला, 10 वर्षात तिकडे गेलो नाही. आफ्टर दॅट ही गोज फॉर ॲफिलिएशन्स और बिलॉंगिंग्स और सोशल नीड्स. मग वेळ काढून आपल्या बॅचच्या गेट टुगेदर्सला जाणं, तिथे आपण काय काय करतोय, किंवा मग तिथली नीड की आपण त्यांच्यामध्ये, आपण तेव्हा कसे अभ्यास न करणारे होतो आणि तरी आपलं आता कसं बरं आहे, हे आपल्याला एक स्वतःला समाधान वाटायला लागतं की अरे आपण तेव्हा खूपच, म्हणजे त्या हॉस्टेलच्या भाषेमध्ये XYZ होतो, पण आता तर आपण ह्या त्या मानाने आता खूपच छान आहे आपलं. असा एक आनंद त्या 35-40च्या आसपास तो आनंद मिळायला लागतो. हे झालं की मग पुढे पैसे आले, SIP झालं, म्युच्युअल फंड झालं, सगळं झालं. आता काय करायचं? प्रॅक्टिस धोधो चालू आहे, पेशंटच्या रांगा आहेत, झोपायला पण वेळ नाहीये, सगळं काही. मग इस्टीम नीड सुरू होतात. मग रोटरी क्लब, लायन्स क्लब, मग एखादं श्री श्री रविशंकरचं एखादं ऑर्गन. दीज आर गुड थिंग्स. आय एम नॉट, सी प्लीज ट्राय टू, आय एम नॉट कंडेमनिंग ऑल दीज थिंग्स. डोंट टेक इट अदरवाइज. it's a life cycle of a typical any person, not just a doctor. Then आपल्या IAPच्या, म्हणजे पिडियाट्रिशियन असेल तर IAPच्या निवडणुका लढवून बघू. एक्झिक्युटिव्ह मेंबर होऊ. IMA मध्ये पण काही आपल्याला कुठे घुसता येतंय का बघूया. थोडक्यात इस्टीम नीड्स, रेकग्निशन बियॉन्ड आवर प्रोफेशन, बियॉन्ड द सोसायटी. आफ्टर सम टाइम, इवन द पर्सन विथ हाय इंटेलेक्ट, सी for any intellectual person, the main thing that keeps him going is challenge. So after that he realizes की अरे अध्यक्ष झालो, ब्रँचचा अध्यक्ष झालो, स्टेटचा उपाध्यक्ष झालो, लोक म्हणतात की आता तू IMA प्रेसिडेंट पण होशील, पण यार म्हणजे बोर झाला आता परत तेच. हा, तर इट इज गेटिंग यूज टू नाउ, इट इज द सेम थिंग अँड आय एम नॉट एन्जॉयिंग इट एनीमोर. फ्रॉम हियर, this column, the upper part of the pyramid or the triangle is self-actualization, and it is here where the thought or the kida of entrepreneurship might enter into your heart, into your body. You start self-exploration. You start thinking that what beyond this, and entrepreneurship can be answer for this question, and it can be the gateway for freedom when you are saturated and at one point in your practice. So let us see what are the virtues of entrepreneurship. कशी करायची काय ते बघू, but what is the basic ingredients or the material that is required of entrepreneurship? First thing, very important, an entrepreneur is always short of funds. If you have a huge accumulated money and you are sitting on a golden mine, then this is not entrepreneur. Entrepreneur wants to invest into new business models. For example, I have started a cardiac cath lab few months back, just 2-3 months back, and I'm just monitoring that at what point I start the break even comes according to my calculation that I did. Like it was a maybe 1.4 cr investment. So around 1 year or 1 year and 1.5 year from now, I will be free from that. The ROI will be, the return on investment will be enough that now the project is on automation and it is going to give me some profit. So the minute, the word meter is very important. I feel very bad when my classmates of 10th standard, they always say that when I miss the get togethers or when some friend miss the get together, they always say कि हम लोग का मीटर चालू है रे, तुम लोग का मीटर, तुम लोग बाहर पड़े तो बंद हो जाता है, तू क्या आएगा गेट टुगेदर को, चल फुट. So the minute the meter of my cardiac cath lab starts, my thought will be, how will I go to a CVTS unit? I want to go to a CVTS unit. I have since suppose we started a IVF center in Vaizapur. It hardly 1 month back. So the next thought would be, can we build some teaching? Can we have some AI in this, or can we have some teaching module in this, and can we invest for the marketing of that? So the point I want to make is, entrepreneur is not that what mutual funds or SIPs. He is always into pumping funds into new projects. Very important. Most important virtue is he is looking for leaders, and very important, he is looking for people who are wiser than him. For me, it is very important for me to have, if I am having people who are not wiser than me, then what is the use? I am looking for people who are wiser than me, who will tell me how to run my business, or for my Ayurved college or for my nursing institute, I need a principal who can think beyond me. So that is a very important virtue for, and a typical entrepreneur, जसा म्हणजे आपण त्याला मराठीत योग्य शब्द हुंगणे असतं ना, जसा तो कुत्रा हुंगत असतो, तसा हा लीडर्स साठी लिटरली सगळीकडे दिवस रात्र हुंगत असतो आणि त्याला वास येतो. वेन यू आर विथ समवन, तुम्हाला कळतं की अरे नाही, हा त्याच्यात दिसायला लागतं ते पोटेन्शियल. जसं एक्सरे मध्ये एखाद्या ट्रेंड, माय फ्रेंड डॉक्टर निलेश नफडे इज देअर, हु इज अ रेडिओलॉजिस्ट अँड अॅनेस्थेटिस्ट. एखादं कॉम्प्लिकेशन किंवा एक्सरे, सीटी आहे, सोनोग्राफी, त्याच्या बियॉन्ड आमचे रवी रमाकांत सर होते, त्यांना त्याच्या पलीकडे दिसायचं लिहिलेलं डायग्नोसिस. तसं एक एंटरप्रिनरनी सवय लावली की त्याला हे लीडर्स असे दिसायला लागतात. सो दॅट इज अ व्हेरी इम्पॉर्टंट, अँड गेटिंग दॅट लीडर्स into your organization is a very important thing. In my organization, I have a team of 4 to 5 people. They are given only one task, 3 to 4 days every month. This is very interesting thing. You may not, but it's a game for our institutes obviously. 4-5 दिवस बाहेर जायचं, फिरायचं आणि बाकीच्या पक्षातले चांगले नेते फोडून आपल्या पक्षात आणायचे, एवढंच काम करायचं. सो for that, the people who will go and talk to the people, because there are a lot of unsatisfied souls in every institute who are very good, so you need to search from them. This is entrepreneurship. Okay, an entrepreneur is a risk taker. He always loves risk. If there is no risk, then there is no life for entrepreneur. He has to deal with failures. It is okay, out of 5 ideas, 10 ideas, few might fail. It is not that every model and everything is going to be a success, but definitely with increasing entrepreneurial venture, your strike rate will increase. If you are failing in 10 out of 10, you are failing in 8 ventures. After some years, you will fail only in 5 ventures. He is ready to be ridiculed. The best idea, if you want to select the best idea that you are having, just talk to your friends, and the idea which will be ridiculed to the highest level will be the best idea. He is not necessarily busy working. Yes, definitely he is busy thinking. He is not busy here. He is busy here. So that is one important virtue. He is not stuck up in one single project. He is into creating processes and moving ahead. The happiest day of my life was when I went to my college. in the morning I go to the gym, and at around 9:30, when I went to the gym, my security guard stopped me and he told, excuse me, you can't enter, you will need principal's permission for that. He phoned, मॅडम MH20 14-22 असं कोणीतरी आलेलं आहे, साध्या कपड्यांमध्ये दिसतंय. And I was just enjoying that process, and I called my brother and told that today our journey as an entrepreneur has started. So जसं ते मला आमचे टीचर सांगायचे की सक्सेसफुल डॉक्टर कोण, की जसं ते महात्मा गांधी भारत असं पत्र गेलं, तसं डॉक्टर अमोल अन्नदाते वैजापूर असं जर पत्र जात असेल तर तू त्या गावातला चांगला मोठा डॉक्टर झाला असं समजायचं. So the same litmus test for entrepreneur is that if your security guard doesn't know who you are, then you are on the path of entrepreneurship, because your leader, the leader whom you have appointed, the principal or the person or whoever, he has appointed that person and you are not his authority. The immediate leader who is above him is the authority for that person. This is the point I want to make. So it is about living control. You are no one. It is a mukti. It is Gautam Buddha's mukti. You just create the process and you just live it. You move away to the next thing. And definitely he lives his idea and hence he lives his own life. When I started my pediatric practice in Vaizapur around 2010-11, around 2012, 2 years I was drifting between Mumbai and Vaizapur. So I always thought, I was in MGM that time, and I always thought that starting institutions is not the cup of tea of an ordinary doctor or an ordinary practicing doctor, and to become Padma Shri Dr. D.Y. Patil or Patangrao Kadam, you have to be born as D.Y. Patil, or you have to be born with that skills. But I met one person, I don't know how many of you know him. These two persons I met. First was a simple general practitioner called Dr. G.T. Pol. If you happen to pass from that Kharghar highway towards MGM, towards Mumbai, on left side, while going to from Mumbai to Pune at Kharghar, you can see a huge campus, G.T. Pol Foundation. This person, G.T. Pol, is a BHMS and a simple general practitioner, I think somewhere in Parel or somewhere that place. So I just happened to meet him somewhere, and I realized that a simple general practitioner like G.T. Pol can also come out with such a huge educational institutes or such a empire of educational institutes. So these things, when I joined practice with my father, this pinched me that being a doctor born with a silver spoon, can I think of something like that? And that time I had 2 or 3 things. I have a brother, elder brother, who was practicing as a gynecologist. Obviously I had my brain. I had some ancestral land close to our hospital. And I realized, for one inspection I went as a pediatrician to, you must be knowing these MLA Narendra Darade and their institutes. Even in Nashik they have a campus. So I saw there that starting any educational institute is just a game of 5-6 things. Purchasing a land, few months of struggle with the government machinery for permissions, appointments of teachers, training of the administrators and teachers to run the institute, and a simple process to run that. That's it. When I realized it, I thought that if I can bring back a child to life, I can resuscitate a child. I was a NALS trainer, PALS trainer, everything. I thought that this definitely is easier than what I am doing. So why not try? Let us try. म्हणजे आपण एखाद्या माणसाला, सगळ्यात अवघड काय असेल तर एखाद्या माणसाला वाचवून ते मेलेल्या माणसाला परत आणण्या इतकं अवघड अजून काय असू शकतं जगात. ते आपण करतोय, ते मी करतोय, तर मग हे का नाही करू शकत. बरं, अपमान गव्हर्नमेंटचं सहन करायचं आहे, पेशंटचं मी करतोच आहे की. इन्स्टिट्यूट्स त्या गव्हर्नमेंट मशिनरी बरोबर डील करा. सिव्हिल सर्जन आणि त्या गावातल्या मेडिकल ऑफिसर आणि नगराध्यक्ष आणि तहसीलदार आणि त्यांच्यासोबत मी डील करतोच आहे. त्याच्यापेक्षा मुख्यमंत्र्याचा अपमान सहन करेल, त्यांच्याशी डील करेल. वाय नॉट. हे मला वाटलं. म्हणजे तेच मॉड्यूल आहे. हे सगळं आयुष्यात घडतच आहे आपल्या, याच्यामध्ये काही असं काही वेगळं काही नाहीये. सो आय थॉट दॅट लेट अस try this entrepreneurial venture, and I tried starting educational institutes. And uh, in few ventures, it's not that I was successful every time, but definitely I could build a Ayurved college or a nursing college with that. The point I want to make is, I don't want to tell that what I have done or this is very extraordinary. Let me tell you, this is extremely ordinary, because very ordinary people are doing it. And the point that I want to make in this talk is that entrepreneurship is not a rocket science. It is very simple, like our medical practice. If you wish to do it, you can do it anytime. You want to do it or you don't want to do it is a different story, but try to understand that it is a very simple thing, and very important, it is answer to a static model of medical practice. So I am finishing with my time, so let us go very fast with the ingredients. I have already told you many of things. The important thing that is important for entrepreneurship is idea. If you realize, see, we were a very good daydreamers during our school days. So but as we grow, we stop dreaming. Why do we stop dreaming? We dream, but we keep the dreams to ourselves for the fear of being ridiculed. So I think that keep a small diary in your pocket, and this is my habit, WCM, what comes to mind, whatever nonsense ideas that comes to your mind, just keep on writing that. It can be anything. It can be like starting a diagnostic facility, or any, it can be starting an ice cream parlor. Let it be. What, who is going to see that? Only you and yourself. So just keep on writing these ideas, and because when you write it and start pondering on that, there is one point where you get a realization that this is the idea that I want and I will experiment with. I have already told you these things. So entrepreneurship can be anything or and everything. Entrepreneurship can be in your own practice, or it can be expanding beyond your practice. This is the example that I learned in 2 days back, and I wanted to give an example of your own district. See, there are a lot of. It is not that no that doctors aren't into entrepreneurship. There are a lot of doctors. I don't know whether you know this guy. He is from Lasalgaon, Dr. Sridhar Daima. He looks like a model, but he is a gynecologist. And at a place like Lasalgaon, he started practice. He came to meet me around 2 years back. That, sir, I am very good in laparoscopy, and you don't give me anything for first 5 cases. I will operate. You see my work, and if it works, we will go ahead. I said that the stage is yours, no problem. So, and he's an excellent surgeon. Definitely, I am paying him. That is not an issue. But after 1 year, even I saw his surgery once or twice, and I told him, and he used to teach all our Ayurveda and nursing and physiotherapy and our postgraduates, DGO students. So I realized that he is a very passionate teacher, and our students were always waiting that when he is going to come. They used to ask us that when Dr. Daima is going to come. I told him, ki boss, these your skills are very good, but you are a very good teacher. So think about this. Go beyond just teaching during your OT. And he started his own teaching sessions or classes for laparoscopy. And today in Lasalgaon, I get calls from all over state that we want, meaning there the seats of Dr. Daima's teaching session this month are full. So can you tell him and can we get admission? And he charges something around 1.5 to 2 lakhs for one that 7-8 days session. So this is an excellent entrepreneur venture that he has come with. I have failed with a teaching venture in Nagar. I had started my own MBBS classes on that. We were student of Dr. Chetan Bhatt. So with the same notes, same style and same jokes of Chetan Bhatt, I tried three years. I taught there and I failed. So it is okay. So the best thing that we have is a teaching skill, our knowledge. So, and there are lot of such examples that I can give you. In our own practice, what can we do? Just think. See, just if you if you stand in front of your hospital and you look around, just breathe slowly for 5 to 10 minutes and just see your hospital and think, what is new, what is the different that I can give in this campus. The first thing that will pop up in your mind, or you talk to your patients, I will tell you the first thing, you will laugh on this. The first thing, My first entrepreneur venture in my hospital was a hospital canteen. If you have 50 people visiting your hospital, take it from me, a hospital canteen is a very good entrepreneur venture running on a auto model. And today I have 750 students lodging and boarding in my campus. So it is about you just think in your practice, you can think there be any value addition. It can be anything, and don't worry to be ridiculed. Yeah. So so value addition for your patients. And I like the Tata's model for entrepreneurship, which says that entrepreneurship comes from social needs. So social need of your city, like my city today has a social need of MRI, or it was CT scan 10 years back. I started CT scan in 2013-14, which proved to be a very good facility in COVID. So I think beyond your practice into products, for a radiologist, it can be a very simple thing, like production of USG jelly is a very simple thing. Any chemical engineer, if you take, you can start that business. So for pediatrician, it can be winning food. Dr. Kasliwal from Solapur has been doing this. Dr. Anil Mokashi from Baramati has been doing this for last 30 to 40 years. E-ICUs for dermatologists, that there can be many things. Group entrepreneurship, Wellness Forever chain, I think you know, it is owned by a simple pharmacist called Manoj Chauhan and Ashraf Bijar. Two simple pharmacists. डिफार्म झालेली दोन मुलं होती. वेलनेस फॉरेव्हरची चेन अख्ख्या भारतामध्ये लॉन्च झाली. एल डोरेंडो, यू मस्ट हॅव heard the name of this pharmaceutical. It is earned by, it has been started by 10 doctors. Diagnostics, I always think it's a dream for me, that why I know that it's a very distant dream, म्हणजे एकदमच अगदीच ते दिवा स्वप्न आहे. बट 50 CR, 45, 35 CR MBBS कॉलेज सुरू करायला आता नवीन नियमांप्रमाणे 50 डॉक्टर, 100 डॉक्टर येऊन एक मेडिकल कॉलेज सुरू करू शकत नाहीत या भारतामध्ये. एक मेडिकल कॉलेज म्हणजे दिस अ व्हेरी डीप थॉट दॅट आय हॅव इन माय माइंड. आपण ते सोसायट्या आणि ते सुरू करतो, 50 लोक येऊन फ्लॅट विकत घ्या, हे थोडंसं पुढे जाऊया. एव्हरी वन ऑफ यू should, if you want to get into entrepreneurship, this is an excellent book by Girish Kuber called Tata, which is the history of entrepreneurial history of the Tatas since Jamshedji Tata. And I can't compare it, and I won't say it's a Gita, but this is my book, my experiments, like my experiments, Mahatma Gandhi's, my experiments with truth. I would say my experiments with entrepreneurship is एका मेडिकल कॉलेजचे बाळंतपण by Dr. Amol Annadate, which is available outside for sale. So thank you very much. Sorry that I exceeded 2 to 3 minutes. Lastly, I would say I would like to make the last point that on all our WhatsApp groups, I always hear a very sort of negative talk की असं होतंय, तसं होतंय, हे वाईट होतंय, हे असं होतंय, हे खूप त्रास देत आहेत, ते खूप त्रास देत आहेत, कॉर्पोरेट हॉस्पिटल्सला सगळे फायदेशीर धोरणं आहेत. See, if we are not going to do it, somebody else will do it. If we are not going to come in an entrepreneurial mode, corporate hospitals are born as entrepreneurs. It is their work, like it is like our practice or seeing our OPD. So they are going to take over the medical field and make the entire medical field highly paid employees. So it's a high time, before they do it, we start thinking of it, and just go entrepreneur in your life. All the best. Thank you very much.
Thank you, sir, for the